In this tutorial, we're going to be specifically looking at the learning environment, and particularly around both affirmative and toxic workplaces. So we'll talk quite a lot about feedback in the next module, but one of the key parts of effective feedback, and this very much comes from the research and very much also comes from the experiences of registrar, is that the relationship of trust is probably the most important part of a relation when giving feedback. So we need to trust the people that are speaking to us. So obviously this talks to our individual relationship with a clinical supervisor, but the reality is that when you are working in a busy work department, you're usually working with a whole bunch of other people who are giving you feedback, both informally and ad hoc. So these could be other medical officers, other registrars, other seniors, maybe even other interns. And you need to be in an environment where you feel, can I trust that to ask for advice, for example, or to ask for support in a particular scenario? So many clinical environments are not actually conducive to trust and safe feedback. And why is that? Why do we actually even have toxic work environments? Nobody wants to show up at work if it's a horrible place to be. You all know the answer to this already as you've been working through our little course. And of course, it's dragons that's causing all the problems. Toxic workspaces can be very mobile because toxic workspaces are always created by human behavior. So certainly having not a lot of resources and having a very busy evening or having too many patients or having a distressing thing happen can all affect how we feel at a workspace. But actually you can have extremely difficult circumstances and have a team working together and really feel like they are thriving and getting the job done, and it's hard and it's exhausting, but we're all heroes in the field. Or you can have a scenario where you're actually in very fancy, posh, well-resourced work circumstances, and it's just a nasty place to show up to. So of course, it's a cycle. If you have a scenario within a particular workspace where there's a person who feels unsafe and stressed, and especially if this is a senior person, so we as a clinical supervisors got quite a lot of power on how we affect that particular environment. That person now feels fear, rage, or grief. Remember, one of our distressing emotions for whatever reason. And this leads to those counterproductive behaviors. So they get critical, they're making long preaches, they try and manipulate and control everybody else. They're ignoring their phone when they're supposed to be called. They feel sorry for themselves. And so you have somebody who's creating this very negative narratives that comes into your department. These can sometimes be directly related to a specific person, or it can affect the people around them. And that person now starts to feel unsafe and stressed and start feeling, especially if they're getting criticized for something that's happened, that of course triggers in themselves all these negative emotions, which now brings up their favorite counterproductive behaviors. So they either criticize back, or they just don't show, or they ignore and end up being not very helpful, or they end up preaching and manipulating somebody else, or they feel sorry for themselves. And this, of course, makes other people feel unsafe. And suddenly you have an environment that's not very pleasant to work in. I find toxic workspaces interesting because as human beings, we spend a lot of time at work, and being in a toxic workspace can be extraordinarily damaging to our emotional health and to our happiness as human beings. It is horrible to work in a space that is distressing. But interestingly enough, we also have extraordinary power to create our workspaces. Toxic workspaces are created by humans, dragons. And therefore, this is also one of the areas we can strongly potentially affect as ourselves as individuals. And how do I contribute to that toxic workspace in my environment? And as I've mentioned earlier, as clinical supervisors, you actually have a lot of power in how you affect the sort of the atmosphere or the space within your department. So what causes toxic workspaces? Stress. Not very surprising. Stress creates toxicity, which creates stress. And sometimes we can go, well, we are in the most extraordinarily stressful environments. And yet I have seen, especially in rural spaces where you'll have a little rural facility out in the middle of nowhere with a very small team of doctors working under extraordinary circumstances. And there is a really can-do atmosphere on the work floor. And although people are exhausted and they work hard, they do not have that experience of being unsupported. So the reason why this is also important and is becoming not just a fluffy thing, like the surgeons would like to call it, that there's now very, very good evidence of the link between toxic workplaces and medical error. So medical error is due to various things. So quite often you just misperceive something, or you make an assumption about something that's not actually correct, or there's a miscommunication that happens. So there's various little things that can creep in that leads to major medical errors in our facilities. But what's important is that these types of mistakes massively increase when people are under pressure. So there's never one root cause or one major cause. There's always a host of contributing factors. So people who are stressed most definitely are going to make more mistakes. And if you've got a toxic workplace where people are experiencing a high level of stress and negative emotions, they are much more likely to make mistakes, and they're much more likely to not get support before asking for advice, for example, or figuring things out. So we want to create a workplace where we can check medical error by making it safe enough for people to ask for advice and to be able to pick up each other's errors and being able to bring it up in safe spaces. So they've now shown that toxic work environments lead to clinicians not asking for advice because they fear humiliation or rejection or attack. They become terrified of making a mistake or admitting a mistake. They're very disempowered. They're not inspired. So we talked about that lovely seek space, being in a space where you're curious and want to solve a problem and want to figure something out. If you're feeling stressed, then you're not curious or eager to learn. You just want to get home. You're not motivated to even be there. And when you look at your seniors, you don't actually consider them particularly resourceful. You don't actually think that they know anything that can be helpful. There's definitely very much a higher rate of medical errors, and very important, there's also a much higher rate of anxiety, depression, and burnout in our clinicians. So it becomes really important to look at how do we mitigate these environments. So obviously the bottom line, which we've already covered in the previous little module, is starting to look at emotional competence and how these dragon behaviors present in work. And what we can do, though, is, and I find that very helpful with my young doctors when they arrive, is that I sit down with the interns and we chat about the feedback culture we are trying to create within our department. So we talk about dragons and we talk about the kinds of things we bring. And we do bring certain rules in terms of how we are allowed to interact with each other or not. And I want to highlight two polarities of feedback cultures that we can see. Most organizations have a mixture of these, depending because you have a mixture of people. We sometimes find with environments that you might have environments that sometimes are a little bit toxic and sometimes are great, depending on who's around and what's going on. And what you want to try and see is, like, overall on balance, where are we striving to, or where are we moving towards as a clinical learning environment? So the first thing, obviously, that we're trying to move away from is the depreciative feedback culture. And it's based on certain underlying irrational beliefs that the dragon likes. And this is the way, certainly, that many of us have been trained, and that is still habits that we find in our workplaces. So it's the idea that you should already know that. So the person arrives at your facility, we always go, oh, there's no such stupid question. And then they ask something and then you roll your eyes, and which university did you go to? And I can't believe they didn't teach you that in internal medicine. And so we sometimes treat our juniors as if they're already supposed to have read something or known something. The underlying idea that we can motivate people through humiliation. So I always have somebody that tells me about how humiliation worked very well for them. Please know that it's the exception and only in very specific scenarios. But generally, most people do not learn well through motivation and humiliation, and does not motivate them to become better than themselves. There's something called the Navy SEAL imperative, which is you throw people in the deep end and they just got to get on with it, and that's the best way to do it. I don't think the Navy SEALs actually do it like that. The idea of toughening people up. The idea that we learn through instruction, so that people tell you what to do and then The hierarchy imperative is that academic institutions that I talk about, that only people much higher up the ladder than you knows things and nobody else can actually teach you. And then the fixed mindset is a concept quite well known in the educational sphere. It's a way of looking at the world, believing you are born with certain strengths and you can't actually learn dramatically new skills. You can expand the strengths you already have, but you can't really, you're either good at something or you're not good at something. So somebody will go, well, I'm great at maths, or I'm not very good at maths, or I can dance, but I'm not very good, or I'm not very good at dancing. And of course, the dragon very much looks at the world like that, in that sort of black and white way of thinking. Where we're trying to work towards is an appreciative feedback culture. And these are aspirations, because this we can do when we are in our higher self. It takes a little bit of work, always showing up as your best self. But there we have to really believe there is no such thing as a stupid question, which means that when people ask you stupid questions, you're always going to be affirmative about, yeah, I'm glad you asked. We want to motivate people through affirmation about what they're already doing well. So if somebody's presenting on a grand ward round and you want to first affirm the stuff that I'm very glad you've got that, well done, excellent, before we start trying to find ways to humiliate them for not knowing stuff. We do want to put people under high stress scenarios, but we must be sure they're well prepared and drilled before you put them into a high stress scenario. Our ATLS courses and things are good examples. The belief that we learn through reflection. So they're not just learning by you telling them stuff, but actually thinking about stuff, going and reading their own stuff, making them responsible for their own learning. The belief that you can learn something from everyone. You can learn from a nursing auxiliary, you can learn from a colleague, you can learn from a peer. And then the growth mindset is this idea that actually we can improve anything, any skill, if we just work at it. And the way we praise people for growth mindset is we therefore not praise them saying, oh, you're such a clever clog, or you're such a good surgeon, but being able to say, you worked really, really hard to learn that particular technique. Oh, I can really see you've put the work in. This almost comes automatically, your appreciative feedback culture, if you are in that higher best self of yourself, where I think all of us has done a bit of the depreciative feedback culture. Now, what's fun when I teach this slide is that there's always well, not always, but there's sometimes a little bit of concerns about us being too soft and too fluffy, and we need to put pressure on people. And that's misunderstanding a little bit what we mean by these underlying beliefs. And to illustrate that, I'm borrowing from a model that I use when I teach parenting. I do quite a lot of workshops in the educational sphere for both teachers and parents. And I could often get asked when teaching parents about what's the better approach for parenting, the authoritative approach or the permissive approach. I know there's a few others in the mix. I'm just going to play with these two for the moment. And you will find that there's also lots of little studies and what you find with the problem with studying authoritative and permissive is that people don't differentiate on whether the authoritative approach was being led by a dragon parent or a master parent, and similarly to the permissive approach. We all have different cultural backgrounds and different ways of being in terms of how we manage, for example, our families or our wards, etc. And being in your higher self does not mean that it's all about being fluffy and kind. It's just about being not engaging from your lower irrational self. And therefore, you can have some families that can have a very strong authoritative approach, very strong hierarchical. Parents are right, children has got no say in the matter. And that can be an amazing parenting approach as long as it's done from a higher level. And similar with permissive. You can have parents that are very permissive. There's no hierarchy within the household at all. The children are very much involved within the decision making. There's no punishment or reward systems. And again, it depends on whether this is a dragon parent or a master parent. So what I mean with this in terms of the clinical supervisor setting, an authoritative approach might be, and we see this very much in the surgical disciplines. So for example, in emergency medicine, it might be very teacher-led, it might be very directive and highly structured. There's a very clear reward punishment structure in terms of when things go wrong. There's a hierarchy. And as I've said, our universities actually function a little bit like this automatically. But you can set very strong expectations. You can set very strong deadlines. There can be very clear consequences if you feel deadlines have not been met. And if you approach this from a a master view, you will have within it the flexibility to understand when a particular registrar is struggling, or when you need to change an approach, or when you need to be able to make sure that you are inclusive in the way that you are working. If you, of course, you are a dragon, well, then you get a trump. So if you have somebody who's in their dragon mode, then all of this can become an extremely negative, toxic environment. Similarly, if you're quite a permissive type of approach in your leadership, our family physicians are sometimes here, much more learner-led. We like to facilitate rather than direct teaching, or our department is much more unstructured in terms of hierarchy. There's no really reward or punishment system. There's just affirmation and support of each other. The structure is completely democratic, with everybody having a say, and no person is considered to be more important than anybody else. Again, if you've got an approach like this, which is very much led by somebody from a higher level, then you will have this a very open, yeah, I guess a bit more fluffy way of managing your ward, and that can still work very well. Everybody feels safe within that. But if you are a permissive and you are in dragon mode, which means that the students have to do anything, they're not clear what's actually happening up, you're not actually engaging with people because you're avoiding what's going on, you're not showing up for work when you're supposed to be showing up for work, you're not actually overseeing when decisions are being made, then this is also going to be a very toxic environment. So I don't think you need to feel that you have to change who you are, or your higher values to be able to create an amazing environment for your registrars. Every single environment can be very busy. All we want to do is we want to keep the dragons out of the mix. So I've got a couple of slides on shifting toxic work environments, and we can discuss that more in the actual face-to-face meeting. Simple things is that obviously you can only put so much strain on people, and at some point they will break. It has been shown that if a clinician is awake for more than 21 hours, then they're performing worse than a person with a blood alcohol level of over 0.8. And so we need to look at our working environments. Is there a good place where people can rest? Are they definitely taking lunch? Are they getting enough time to just at least get to the loo and drink some water? Very important. If you want to create an amazing work environment, it starts very much on the top, unfortunately. The leader within a particular ward, the main people who are running that particular team that evening, the supervisors, the CEOs of the hospitals, depending on how they behave and their own dragons, is going to filter down to the entire organization. So as clinical supervisors, we carry a lot of responsibility in the teams in terms of what is happening. And we want to try and build supportive and affirmative work teams. And I've got a slide with a few tips on that. So we actually already have amazing values in terms of how we think teams should happen. And what we want to do is just really embrace those high values. So if you already have those higher values, have them up on a wall. You can, Bartopele gives us lots of lovely things. But for example, you might have, we in this value department believe in inclusivity. Everybody has a voice. We believe that courtesy is always important in every interaction. We have generosity and assumptions. If somebody is behaving badly, so these are just examples of values. And these values need to be explicit, and there needs to be a way of building towards this is the way we behave in our department. I mentioned earlier that compassion is a superpower, and that you can, as a clinical supervisor, apply to those toxic, difficult work environments and interactions to try and restore safety and figure out what's going on. And then the big thing, which is what these 2 days is going to be very much about, is being able to learn methods of giving feedback that encourages questions and that creates safety. So one of the things with the clinical supervisor, one of the most important things, or your job as a clinical supervisor actually, is being able to pick up learning gaps that your registrar might have and helping them to correct those gaps. That's sort of core business actually of learning. Our clinical supervisor job is not to do long lectures for them. It's actually just there to help shape their work. And that means being able to give critical feedback on things that are not right. And the way we give feedback has a massive effect on what that work environment feels like. And we were looking a lot at those in feedback tools. Thank you very much. We've got one last little module where we're going to actually look at appreciative inquiry as one cool tool that you can use when you are in higher mode.